Stop Fistula is a project majority for Africa who is established in Liberia since 2013, and we're there to fight the obstetric fistula. So the main action is to prevent and to treat fistula. And in case of prevention, we are giving the free antenatal consultation to the women at risk of developing obstetric fistula. So those kind of women, they're less than 20 years age, are coming to Catholic Hospital and the other clinic partner for free deliveries. And why they come for antenatal consultation, we can know in advance those who are susceptible to develop obstetric fistula. So by giving them the free deliveries, we encourage them to come to the hospital. So most of them explaining that they can't come to the hospital because they can't afford the fee. So by paying them the fee to come to the hospital, so we have chance to give them to avoid developing obstetric fistula. And when they come to the hospital, those we see that they are about to develop fistula, we can give them the free deliveries too. They come to Catholic Hospital, we have a partnership with Catholic Hospital. The Measure for Africa can support the fee to the hospital, and they can come just to give the free deliveries. So with that, we help them to avoid developing fistula. Because 80 to 95% of patients developing fistula are those who try to give birth at home. So by stopping them to give birth by home, come to the hospital, we are helping to decrease the fistula cases. And apart from the prevention, we are side of treatment. We registering the patient who already get fistula, and when we reach 20, 25 or 30 patients, we call the team, the surgeon, the gynecologist, the anesthesia from Spain, who come to conduct the fistula surgery here. And all those surgery are free of charge for the patient, because the Foundation, Measure for Africa, they pay the fee, the surgery fee to the hospital.
The last question, I want to ask you about the panic operation with the nursery anesthesia.
The what?
Again, the last part of your phrase about the Spanish collaboration, the surgeries.
Okay, the surgery parts.
Yeah.
When cars stop.
Can I? You are a nursery study student?
Yeah, student nurse.
Okay.
And you're in practice here?
Yeah.
Continuamos para bingo. Grabando, ¿todo bien? Okay.
Okay. So I was saying that.
A little bit silent, please. Thank you.
Smile and look to me.
Good. I was saying that in treatment side, we register the patient who already suffering from obstetric fistula. And after registering 20, 25, 30 or 50 patients, we call the team from Spain. The doctor can come from Spain, conduct the fistula surgery, Catholic Hospital. Those surgeries are free of charge from the patient. So the Foundation, Measure for Africa, can pay the fee to the hospital. So the team can come, they wait for 1 week, 2 weeks of surgery, and after surgery, me, who is a part of the Foundation, continue managing the post-operative surgery patient. And after keeping the patient for 21 days to the hospital, we can let them go home. There are some who can cure, others can go with perhaps incontinence, or we need to come for the second surgery.
And if you want, why the fistula is still a problem for the women?
Yeah, the fistula is still a problem for the women. It's just because the lack of hospitals, the place the patient needs to go to give birth. And most of the patients are leaving the place, they are not access to the hospital. And once they are in labor, they don't know that they will not be able to give birth by themselves. And they can stay home and start forcing for them to give birth. Because the fistula happen when the woman in labor, the woman who is not able to give birth by herself, perhaps the child is big or the pelvis is small, and you stay in labor for more than 24 hours. So there are other patients who stay in labor for 3 days before no one can know how to detect the person if the patient is at risk and needs perhaps surgery. And even if the patient needs surgery by the place they are living, no doctor, no hospital for them to go to have surgery.
Good. Good? Yes. Yes, very clear.
Okay.